Yeah, babe. I'm on a press conference. It's about to start.
Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's weekly news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and introduce who is on our panel today. We're joined by Amarillo Mayor Ginger Nelson, Casie Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center, Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamanteer, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. Let's go ahead and start today with Amarillo Mayor Ginger Nelson. Mayor, how are you today?
I'm well, Dave. Thank you. Good morning, Amarillo. Another historic week for our city. First of all, I hope you had a Merry Christmas, and I'm anticipating a prosperous and a joyful new year in 2021 for our entire city. I want to start the press conference this morning. I have had so many questions from you, and they're good questions. And I just decided nothing I had to say mattered at all, but your questions really deserve an answer this morning. So we're going to start with just a little bit of question asking. I've asked Casie Stoughton if she doesn't mind just letting me pitch some questions to her. So if the rest of the panel will just bear with us, I've got a list here we're going to work through and see if we can't get citizens the information that they really need to have about vaccines. So Casie, tell me, how many vaccines do we have with the Public Health Department that are in the custody of the city?
So we have had 10,000 doses of vaccine shipped to us so far. We have given we gave about 500 on Monday and about 500 on Tuesday, and we've given quite a few this morning. And so we've got a lot of vaccine, and we're happy to be giving it.
And so this morning we'll start giving vaccine to people in what categories?
So we will start this morning, just after this press conference, giving the vaccine to people in the 1B category. And that is the people who are 65 and older, or people who are 18 and older who have chronic healthcare conditions that would put them at higher risk for complications of COVID. And the reason that I say 18 and older is because we have the Moderna vaccine available to us at the health department, and that vaccine is licensed for 18 years of age and older.
Casie,
So
let me ask one question there. How many people do you estimate in our community would actually be eligible for that then? Tens of thousands, correct?
Probably so. I think that's a fair number of people. That includes people who have chronic kidney disease, chronic lung disease like COPD, heart disease, who have a BMI over 30, who might have had a solid organ transplant. And so that's a fair number of people. And so we will be giving vaccine throughout today and tomorrow until 7, and then throughout next week as well, depending on how long we have vaccine.
Okay, sorry, Mayor.
No problem. That's a good question, Dr. Milton. So I'm very excited about that, to hear what the city is doing to get vaccines into the arms of it. A vaccine on a shelf doesn't do anybody any good. And so I just want to say right up front how proud I am of the work that you and your team have done to stand up this vaccination clinic at the Civic Center. So it's been vaccinating citizens who fit in the 1A category, healthcare workers, frontline workers. But now today we're going to open up that and expand vaccinations to people in the 1B category, people who are age 65 and older, people who have high risk underlying other medical conditions. So I am very, very excited about that for our citizens. And now I will say too, I know we're going to run out of vaccine. That's expected. But that's a good thing, because what that means is the system we've set up moves our vaccines out into citizens, and it doesn't leave them sitting on the shelf. And I know the state of Texas, and Casie, I'll pose this as a question, is the state monitoring how quickly we give these vaccines? And
Yes.
Are they making decisions on how much more vaccine we're going to get based on how quickly we're getting it out to people?
Absolutely. So we have been asked to enter the vaccines that we give into what's called MTRAC. So that's the state registry. We have been asked to enter those vaccines within 24 hours. And so while we have our teams who are registering people and who are giving the shots, we have a team of people who are entering those vaccines into MTRAC right here on site at the Civic Center, because we want our vaccines to be registered so that we can get more quickly. And so we do have on our city website on AmarilloAlerts.com, we want people to know when we have vaccine and when we don't have vaccine, so that they don't come down to the Civic Center thinking that there'll be vaccine. And so we have set up kind of an alert system so that you'll know when there's vaccine. And so on AmarilloAlerts.com, there will be a special, there's on the scroll down just a little bit, and you can see where it says priority 1A, that's the healthcare workers and those residents and staff in long-term care facilities. And then group 1B, that is the people 65 and older and people with chronic health care conditions. And right now we have vaccine available for both groups. In the event that we run out of vaccine and we do not have vaccine available, that will say unavailable and be in blue. And so you'll know that we do not have vaccine available and you don't have to come to the Civic Center. We also have hyperlinks here so that you can click on the phase 1A, 1B for more information. So you can see that. And then we also have another link to the state's website there at the bottom. And so we want you as a citizen to have as much information as you can access. That's the same information that we access as a public health department. And so we want you to have as much access at your fingertips as we have. In regard to the clinic, you have to go in entrance 3. That's the north entrance. That's the entrance into the clinic here at the Civic Center, and will be open.
I'm going to interrupt you just a sec. Pardon
Yes.
me. Are you where you could take off your mask? For some reason this morning we're getting feedback on your microphone. It's like your mask is touching the microphone.
Okay. Is that better?
Yes, it is
Okay.
better.
Great.
Okay.
So I'm using a headset because I'm in a room with a lot of people.
Okay, wonderful. Then I don't want you to take your mask off, but that is better. The information is so important. I want to make sure people can hear it.
Perfect. Yeah, so we will be serving people through entrance 3, that very north entrance. And we will be, today and tomorrow will be open until 7. Next week, we'll be open Monday through Friday until 5. And then on Saturday, January the 9th until 2 p.m., 9 a.m. to 2 p.m. So we'll make a little adjustment there on the website. We're not open every Saturday, but next Saturday, 9 to 2 on that January 9th. So we'll have all the information that you need to come to the clinic here at AmarilloAlerts.com.
That is excellent, excellent information. A citizen should check that website before they head down to the Civic Center. Make sure it's green. They can go in depth to see if they qualify in category 1A or 1B by touching those hyperlinks and just reading through the qualifications. And the hours on the clinic. I think it's real important just to emphasize that you're going to be closed on Friday because it's New Year's Day, and you'll be closed New Year's weekend, but then you'll be open again. And those hours for the clinic are on the website, AmarilloAlerts.com.
Yes.
Okay, I have a few more questions. You're doing a great job. You're doing a great job of getting this information out to the citizens. Talk just a little bit about how the city gets its supply of vaccines. Like, how do we find out when we're getting a vaccine? How much notice do you get?
So we have as much notice as you do. So we found out, like we checked that website that Jordan just pulled up religiously. Yesterday when the week 3 allocations were posted, we checked that and found out that we were getting additional doses. And that same day, the doses arrived at our clinic. And so I think the main thing to remember there is that this is a very fast-paced situation. We don't have a lot of lead time. So the planning that has gone into this is a result of years of planning and practicing our immunization clinics, because we just don't have a lot of lead time with regard to notification of how many doses or when we will get doses of vaccine.
Yeah, and I think I was on a call yesterday with the state, and they were talking about, they get the supply from the federal government and then they push it out to the counties and they have basically about the same time frame. They don't have any knowledge on what's coming next week. So, week 2 was a large distribution, hundreds of thousands of doses. But then week 3 was a smaller distribution because of some plans that the federal government rolled out to vaccinate people in nursing homes. And they didn't see any of that change coming. So they have a very small visibility window, and that trickles down to us having a small visibility window. But that's why the clinic is so important. It will be open. And when we have vaccine, you will be able to see right on the website, we have it, come get vaccinated. And here's who we're vaccinating. And here's the list of what it takes for you to know whether or not you're in that group of people. So we're just trying as hard as we can to get the information out to you as citizens and to get you vaccinated if you want a vaccine as quickly as we possibly can. So Casie, then talk to me just a little bit about what it looks like for somebody who wants to come over and get vaccinated. Do they have to pay? Is there a cost?
Yeah, those are great questions. So no, there's no cost. We are receiving the vaccine at no cost, and so we're passing that on at no cost to our community. We do have some paperwork that has to be filled out because we have to register those vaccines with the MTRAC. But so we have minimal paperwork, and then we have the best nurses in town that will give you your vaccine, and then you wait for 15 minutes with our amazing fire department. So we have some really great collaboration with our city departments, our fire department, our police department, our public health department, our civic center. We're all here to make sure that we have a smooth clinic and that you are taken care of quickly and safely. And we've had a great morning.
Why do people have to wait in the room with the fire department for 15 minutes?
So we just want to make sure that there's not going to be any adverse reactions to the vaccine. And if there are, they usually happen in that first 15 minutes. And so we can safely take care of someone. I think we've had maybe one situation in the fire department, we were able to care for that patient. And out of all of the patients that we've treated or provided vaccine to, so we're just really having a great week.
What documentation does a citizen need to bring with them if they're coming down to get vaccinated?
They just need to bring themselves. We ask they can't have had another vaccine within the past 2 weeks. If they've had a monoclonal antibody infusion like the bamlanivimab, they can't have had that within the last 90 days, and they can't be currently ill or in quarantine for COVID-19. And so those are really the restrictions. If they're allergic to one of the components of the vaccine, then they certainly don't need to be vaccinated. But really the restrictions are quite minimal.
So do they have to bring proof of a medical condition if they're not age 65? How do they just come up and visit with you about what that is?
Right, so that would just be a self referral. We don't require proof, but we do ask that people be honest, that they allow the vaccine to be available to those who truly need it, and that in time we will have enough vaccine for everyone who wants it. But right now we're trying to save the vaccine for the people who truly need it. And that is the people who are 65 and older and have chronic healthcare conditions as outlined by the state. And so if you have a chronic healthcare condition or you're 65 and older, then we certainly want to vaccinate you. So
good.
Come see us.
Does a citizen or can a citizen make an appointment to come to the clinic?
So that's another great question. This is a walk-in clinic, so an appointment is not required. That does sometimes mean that there will be a little bit of a wait in line. So it's helpful if we kind of stagger those, stagger that throughout the day. So not everybody has to show up at 9 a.m., but we don't require appointments.
Okay, what if a citizen needs a ride to get to the Civic Center? Is the city helping on that?
Another great question. So our transit department has partnered with us, and they will be offering a shuttle service. And I think Jared Miller may have that phone number. I don't have the phone number right now here with me at the Civic Center, but
yeah, Amarillo City Transit, the number is 378-3095, and you call that number, they'll work with you to get arrangements to get you to the testing site or to
At
the
no charge.
site.
And those are free rides. Is that correct, Jared?
Yes. What I know is the Amarillo City Transit is providing free rides to the drive-through testing center site. I will verify, but prior to my opportunity to provide comments.
Okay, great. Casie, how many vaccines a day, given that we have the right supply, how many vaccines a day do you think we can give at the Civic Center clinic?
So I think we can give, with our current setup, we can give between 1,500 and 2,000 a day.
Okay, that's great. What if we get a large distribution? Like, what if the vaccine ferry delivers 50,000 vaccines at your doorstep yesterday? Do we have capacity to get those into people as quickly? What are your thoughts on that?
Yeah, so right now our plan is to be able to provide vaccine at the Civic Center, and to do that through a central location so that we can be a central location for everyone here in our community. However, if we were to receive that large of a shipment, we do have and are looking at alternate plans to be able to provide clinics at alternate locations. And so those plans are in development, and we're looking at every possibility, because we just, with the way kind of the short notice that we're receiving, we just don't know exactly what we're looking at next week. And so we want to be ready for anything.
Yeah, and we don't have an expectation that we would get a large distribution like that. I just know that I want to know you're working on a plan in case we do, because again, I think the biggest waste is any vaccine sitting on a shelf. Vaccine needs to be out in the community, in people, helping them, number one, stay safe, number two, build herd immunity for our city and our region. So my last question is just more about these categories 1A and 1B. How do we decide, how do you know at the clinic who fits in these categories and who can receive a vaccine?
So the Texas Department of State Health Services has convened what's called the Expert Vaccine Allocation Panel. And that panel has spent many hours looking at risk factors and epidemiology, and has put together the allocation plan for the state of Texas. And so they make a recommendation to Dr. Hellerstadt, who's our Commissioner of Health, and he puts out the recommendation, or that phase 1A and 1B, and then as we move through the phases, then he and the Texas Department of State Health Services provide that information to us as healthcare providers and local public health departments. And so that's where we get that information. We don't make those decisions at a local level. We're working through that as the state of Texas, really driven by the state health department. Okay.
And so we're working very hard to, again, cover the people who are most vulnerable across the entire state. And that committee that has come up with those principles, and we're choosing in Amarillo to abide by those statewide principles. As an aside, were you asked as an expert to sit on that panel?
I was, and it has been a pleasure to serve alongside that team.
Yeah, well, we appreciate you. We appreciate your expertise and everything that your team is doing to serve the city. I think that covers the list of questions that I wanted to talk about. Although I am curious, what would you advise a veteran? And Dr. Gonzalez may address this here in a moment. They could go to the VA hospital and get a vaccination, but they also could qualify just to walk in at the Civic Center. Is that right?
Yes, absolutely. If they're in that 1B category, then we certainly welcome them. There are opportunities at the VA to be able to be vaccinated. I think, I think the very best thing to do is to touch base with their provider at the VA and to see what that vaccine availability looks like through the VA. And I know Dr. Gonzalez will give us an update, and we look forward to that. We're happy to serve. We're happy to serve anyone here in our community, but there are opportunities through the VA. There's opportunities through other providers and other clinics, and we'll make sure that we have that information up on AmarilloAlerts.com, because the public health department is not the only clinic in town that has vaccine available.
Okay, wonderful. I think that covers my questions, and doctors on the panel, I hope if there was something you wanted to add in during your remarks, you would feel free to just comment on any of those questions and the answers that Casie gave. So Casie, I'm done. I'll hand the microphone to you.
Hey, Mayor,
Okay.
before we jump to
Yes.
that, I did want to confirm that the rides on Amarillo City Transit for both the drive-through testing site and for vaccinations are all free right now.
Great.
Federal Transit Administration has helped out tremendously there and has provided funding for that express purpose to be able to provide free public transportation during this time.
Good. Thank you very much.
So I'll run through the public health information very quickly and then hand it over to Dr. Milton. So as of yesterday, we had a total of 28,779 total cases of COVID-19 in Potter and Randall counties, 15,037 cases in Potter County, and 13,762 cases in Randall County. We have a total of 24,547 recoveries, and we are up to 480 deaths reported in our community. That leaves us with 3,772 active cases. The rolling 7-day positivity average for Potter and Randall counties is 9%, and the positivity rate at the drive-through testing site, which is a subset of the total, is at 33%. The 5-day positive new case average is at 183 new cases per day. The public health drive-through test site does remain operational until 3 p.m. today. Individuals can call 378-6300 to be screened and directed to the test site. The drive-through test site will be closed on Friday, January the 1st, and will reopen Monday, January 4th. GA32's hospitalization rate for the 25 county Panhandle RAC region has been over 15% for over 2 months. Yesterday, the RAC's hospitalization percentage was at 22.89%. That means that over 22% of all hospitalized patients have COVID-19. Our community remains at status level red, and conditions are consistent with all of the indicators being over the threshold for level red. The outpatient bamlanivimab infusion center is currently open and serving patients. We did send a health advisory to area providers with referral information and encourage them to refer patients who meet the EUA eligibility criteria. The mayor and I discussed vaccines at length, and we do encourage anyone who's in that phase 1B category, 65 and older, people with chronic healthcare conditions, as well as people in the 1A category, frontline healthcare workers, to seek vaccine. The public health department has a clinic open at the Civic Center through entrance 3 today and tomorrow from 9 a.m. to 7 p.m. But there are also other vaccine opportunities available in the community, and we'll have those opportunities up on AmarilloAlerts.com. That's all I have today, Dave. Thank you so much.
Thank you, Casie. Let's now go with Dr. Scott Milton, Public Health Authority, Texas Tech University. Dr. Milton, how are you today?
I'm good, thank you. First of all, this is our last press conference for the year. I wanted to thank everyone here on the conference and everybody that I've been working with. You know, I just couldn't have asked for a better group of people to work with under these circumstances. I wanted to talk a little bit more about numbers. Casie just went through that. And I just want to stress that these numbers are still way too high. What we know when we look at these numbers as we've done so throughout these months is that the active cases that we see in the community translates into hospitalizations. And those hospitalizations, unfortunately, translate into deaths in almost a predictable fashion. And we have still way too many people hospitalized. Our numbers are better with our active cases, but it is still incredibly high. And we can predict, unfortunately, that because of these numbers, we're going to continue to have deaths. So now that we have a vaccine that's become available, it really has become a race. This is more of a race to try to get our immune status better in this community, to try to achieve herd immunity as quickly as possible and minimize the hospitalizations and active cases and deaths. So I'm stressing everyone to stay in touch with their healthcare providers and with people at the health department. Try to keep your ear to the ground about when vaccine becomes available. And let's all try to keep moving forward to get as many people vaccinated as possible. It's safe, it's effective. I've had mine more than 2 weeks ago. I had a little bit of a sore arm and that's it. And so that's what we all need to do. This is what we need to do as being good, responsible citizens in this community, in this country. So I'd like to hear from Dr. Weis and Dr. Lamanteer now. Thank you.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weis, Chief Medical Officer from Northwest Texas Hospital. Dr. Weis, how are you?
Dave, I am excited about the end of 2020. I cannot imagine being happier getting to throw away my far side calendar for 2020. And once again, I dated myself. Anyway, it's hard to imagine that it was February 11th that the World Health Organization created the term COVID-19. I mean, I can't imagine a term that has been used more around this world for the last 10 months than that particular entity. But I wanted to just give an end of the year kind of update on what we've seen at Northwest since February 11th when that name came out. So we have seen a total in terms of people under investigation that have come with possible COVID. We have seen 15,259 individuals come to our hospital. And out of those, 4,434 tested positive. So it was literally 1 out of 3 people that came that was a PUI were confirmed to have COVID-19. Now, out of that, we had 1,329 people that were inpatient with that diagnosis of COVID-19. And the tragedy is, out of that, we've had 189 individuals lose their life to COVID-19 at Northwest, despite our best efforts. And that obviously is a tragedy for all the families that have had to live through that. Now, if we look at remdesivir, we've treated 622 people in the hospital with remdesivir. So that is almost 50% of the patients that came to the hospital with COVID-19 did receive this drug as part of their regimen, as well as Decadron. And then we're talking about bamlanivimab. We have treated 93 people as outpatients with that monoclonal antibody. And now we're working hard to support the citywide resource for the bamlanivimab infusions. And that is going well. And I want to appreciate the city and the public health department for helping set that resource up for the referral from physicians all around this community for patients that need that monoclonal antibody. So let's talk about Northwest numbers today, because this is why I'm really excited. We have 74 positives in Northwest. And here's the thing, when we do the governor's calculation, that puts us at 14.95% of our total licensed beds are COVID-19. That is the first time we've been at 15% or under since the second week of October. Mm-hmm. That's fantastic. And even though the whole, as Casie said, the whole area is still at about 22%. For us, we have hit 15%. That is very exciting. Right now, we have 30 in the ICU. 22 of our 27 beds in use right now are going for patients who are suffering from COVID. But again, just as we've seen all these numbers decreasing, yesterday we were at 17% of our outpatient testing for positives. For over the last 2 weeks, we have stayed consistently at 20% or less in terms of outpatient positivity testing. So again, all these trends are going in the right direction. And now with the advent of vaccine, I think we're seeing the end of this marathon that Casie has talked about previously. Vaccines, we continue at the hospital to focus on our staff and all the Northwest related healthcare providers. Now, obviously, we have a limited capacity to give vaccines relative to the incredible resource that Casie and her team have set up. So we will continue to support the city in terms of that centralized resource to make sure you get the fastest throughput for people who want vaccines. With regard to our staff, we're down to 36 quarantine staff members. We were at 150 plus 2 months ago. Again, fantastic. We're seeing all our own staff being able to come back to work and back to their jobs at the hospital. I think just in closing, clearly there is no part of Northwest Texas that has not been affected by this virus over the last 10 months. And that means all the changes in our physical plant. It means all the change workflows, all the things our staff have had to do differently over the last 10 months. And we're looking forward to 2021 being able to put everything back where it belongs again. So it's going to take the same process to reverse it, but that's going to be an exciting process. And in the end, I want to personally recognize and thank Casie, Dr. Milton, Dr. Bell, and the whole Amarillo Public Health Department for this unbelievable guidance through 2020. You have my utmost respect for all the support you gave Northwest. And without your leadership, we wouldn't be here today giving such great news. That's all I have today. Thank you.
Thank you, Dr. Weis. Let's now go to Dr. Michael Lamanteer, Chief Medical Officer for BSA. Dr. Lamanteer, how are you?
Good, David. Good morning. Good morning, Amarillo. I'd like to start off with just talking about some of our BSA statistics today, and then we'll get into a couple other comments and points. Today, we have a total of 355 patients in-house at BSA. That is a high census for us overall in terms of total heads and beds. 223 of those are on our med-surg units, if you will, adult med-surg. We have 117 COVID patients today. We had dipped down into the 90s about a week or so ago, and then had been hovering in that 100 to 110 range. Today, we're up to 117. That number is better than where we were, obviously, when we were peaking above 200. If you look back about a month ago, so we're down significantly from that number. However, we still have a fair number of COVID patients here. And as comments from Dr. Milton also revealed, we are not out of this danger zone yet. So we have to keep doing what we're doing to try to prevent infections and prevent disease. Of the 117 that we have in the hospital, 52 of those are in the intensive care unit. And of the 52 that are in the intensive care unit, 28 COVID-19 patients are on the ventilator at this time. Fortunately, we're only using about 47% of our total ventilator capacity. Right now, however, we are using about 93% of our ICU beds. We have a growing population of non-COVID ICU patients, a total of 87 patients today in our intensive care unit, which again is well beyond the number that we typically have had as far as our historical ICU structure, which means that we're still using some additional ancillary sites in our hospital where we created extra ICU beds in order to manage patients that have critical illness. We're down to 50 staff members quarantined, and I would echo Dr. Weis's comments that is a dramatically improved number compared to where we were previously. So we're very happy about that. And a small portion of those 50 are nursing staff, which is also good news. We're still running a fair number of patients through our respiratory triage unit, anywhere from 30 to the mid 40s per 24-hour period of patients coming through respiratory triage. The interesting thing is that our flu volumes are essentially non-existent. And you have to believe that the masking efforts are helping to contribute to our reduced incidence of flu cases. We only have 0.14, that's 0.14% of our isolates testing positive for flu. And that was in the month of December. And we have had no co-infections of flu and COVID-19 in the month of December, which is good news. So happy to report that as we are creeping further into what would be typically known as the heart of flu season as we move from December into January and February. From a standpoint of vaccines, I would again echo comments that the efforts for the individuals involved with the Department of Health, Texas Tech, both Northwest and BSA leadership teams in terms of getting vaccinations out to all of our healthcare workers, and now trying to move forward to essential workers and those in 1B. I think it's been a heroic effort. I know that our folks here at BSA have been working tirelessly to make sure we're vaccinating all those individuals who want the vaccine. Certainly not, this is not a mandatory vaccine. This is something that is voluntary, and we are encouraging it for sure. And right now we've been vaccinated at BSA at least 1,300 employees at this point, and are continuing to roll through that 1A list. And now we're also working on efforts to vaccinate the RAC staff that have been helping us, and opening up some of that based on discussions with our city health leaders and the state leaders. We want to make sure those individuals that have helped us are getting vaccinated. And then, assisting with whatever we can do to make sure that that 2-shot series is working for those folks as well. The vaccine has been very well tolerated here. We've had essentially very minimal evidence of any kind of adverse reaction, as Dr. Milton mentioned as well. So again, with both vendors, we have administered both Pfizer and Moderna vaccinations, and both have been well tolerated. We are also being aggressive with offering the monoclonal antibody therapy, working with the city on our tent strategy here in our parking lot to offer that to individuals who qualify. And also we are offering that through our urgent care center as well, and to patients who qualify and are appropriate in our hospital setting for outpatients. So again, that's about 123 patients we've treated as of Monday with monoclonal antibodies. Also very well tolerated therapy. We had one patient with an anaphylactic reaction, we believe, but that was it. And that's pretty much par for the course based on what we've seen across the country for facilities that have been dosing the monoclonal antibodies. So again, I think that the light, I believe, is at the end of the tunnel. And I say that because I think the vaccine is our savior, in addition to our compliance with initiatives to reduce disease transmission, masking, good hand hygiene, social distancing. I know those are the 3 other things that you've all heard for 2020 ad nauseum. Again, we can say that with a little bit of a snicker, but it's really true. We have to do those things. Otherwise, we're not going to get through this pandemic. And again, the vaccines in and of themselves are not enough. What I mean by that is once you're vaccinated, you have to get through 2 shots. You have to get through the appropriate time period before you are hitting a high level of immunity. So certainly there's the potential to be infected early after your first shot if you're not complying with masking and doing the things that we've been doing now for months. So we would really strongly ask folks to do those things despite being vaccinated. And we also don't know if you're vaccinated and you're immune and not going to get infected, but if you're going to be a carrier of disease, to be able to transmit it to someone else, even though you're not infected, which is another reason why continued masking is critical. So again, I think our foresight into the new year is positive. We have vaccine. We have a strategy to move it out to the public and those that need it most first. We are working diligently as a community. The leaders on this conference call, the leaders in the hospitals, also with Texas Tech leadership, and the physician offices that are getting vaccine, that I know, and talking with folks that are already moving forward with that 1B population and doing their part to help us reduce disease in the community. I want to applaud their efforts. So again, thank you. I wish everyone a happy new year, and we'll continue to do our best to take care of the citizens of Amarillo at BSA.
Thank you, Dr. Lamanteer. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
Doing well, David. Thank you. First, I'll start with our numbers. Here at the Amarillo VA, we have 7 COVID patients, 5 in our ICU. Continue to take care of 2 non-veteran patients that we've seen of the 21 total we saw. Now, just a little bit of our year-to-date summaries, and we did our year-to-date a little bit different, and we take care of 50 counties of veterans, or 50 counties we're responsible for throughout 5 states, Colorado, Oklahoma, New Mexico, Kansas, and Texas. And if you look in those 50 counties, there have been 945 veterans with COVID positive. Now, amongst those, 33 have passed away from COVID positive. So now you can see why the panel is very optimistic, because we are seeing a light at the end of the tunnel with the vaccine being present. I do want to reiterate exactly what Dr. Lamanteer just said. Despite the vaccine, and even for those of us that may have been vaccinated already, it's important to realize that we have to still wear our mask. We still have to practice social distancing, still have to do good hand hygiene, still have to make sure when we are ill, we're not going out to where we could potentially be spreading things to others. And so we are vaccinating here. Our health staff is still at the Amarillo. We have vaccinated several hundred of our healthcare workers here. We did get 300 doses of vaccine down at our Lubbock clinic, and they're going to begin vaccinating, I believe, today or tomorrow, their healthcare workers. Now, Casie had talked about, and the mayor had talked about, what about veterans? So right now, we have a plan to begin to vaccinate some of our high-risk veterans next week. And some of our high-risk veterans will get a call tonight to let them know how they can set up appointments to get the vaccine. We do have a very small quantity right now. We very similar to what the city just said, we don't get a lot of advance notice. In fact, I think the Lubbock clinic, I literally found out the night before that they were getting vaccine the next day. I've been told we will likely get more next week. However, without knowing how much, it's hard for me to plan how many veterans I can begin to vaccinate. So to answer Casie and the mayor's question, for veterans who want to know, please call, talk to your team here. We can let you know if you're high risk and whether or not we can get you in here for vaccine. However, if you go and you get vaccinated elsewhere, please call, let us know so we can document in your record, make sure that we understand you've been vaccinated so we can get other veterans who may need to be vaccinated in line. I do want to mention, as I've said before, we continue to have COVID testing available to our veterans at no cost. And as another summary of 2020 is I moved here about 7 months ago. Left the busy DC area to come to the Texas Panhandle. And my wife and I have absolutely enjoyed it here. Our children enjoy it. I just can't wait till we're able to get out and see more of Amarillo, more of the Texas Panhandle as this pandemic, we start to see it go away. And that's the hope of what this vaccine brings. And I really want to thank our veterans. They have been very patient with us. I know that we've disrupted the normal routine of your healthcare by not being able to come in and see your doctor, having to do things over video, over telephone, limiting the number of face-to-face encounters. And so do appreciate everything you've done in supporting us as we continue to work through this pandemic. And I also want to thank our employees. It's been absolutely amazing to see how you have responded to this pandemic, how you've responded to changes that have come down, and making sure that we're doing everything we can to take care of our veterans. And in the cases of those 21 non-veterans that are facing COVID. And I want to give it a special shout out to our over 45 staff members who went out to other VAs, other areas to support them through their COVID surges and natural disasters, hurricanes over this last year. And then we've also had about 30 VA staff members from other facilities come and help us through the surge that we've, and I don't want to say we're through it, because as the other doctors have mentioned, they continue to have a large number of COVID patients, but as we seem to be on at least a downward trend of this current surge. And so really want to appreciate all those that have helped us. And so with that, I'd like to thank the other panel members and thank the City of Amarillo for this opportunity to talk to my fellow veterans. Thank you.
Thank you, Gonzalez. Let's now go to City Manager Jared Miller. Mr. Miller, how are you today?
I'm good. Thank you, Dave. I just want to reiterate that the drive-through testing is open, and you can call Amarillo Public Health at 3300. They will screen you over the phone and refer you to the drive-through testing center. Amarillo City Transit is providing free transportation both to the drive and to the vaccination site at the Civic Center. If you need transportation, we want to make sure you can get to the test or to the vaccination. So please call 378-3095 and they will arrange transportation to the testing site and to the vaccination site. Now, one side note on the vaccination, staff has let me know, or team has let me know that there are some people who don't want to provide the necessary information so that we can provide the vaccination. We are required to take just a very minimal amount of information so that we can make sure that the second dose is available to that person. It helps us make sure that that dose gets sent to us. And it also helps us make sure that we can contact you to let you know when to come in for that second dose. We understand that some people don't want to provide that, and that's a decision that each person's going to need to make. We cannot give it if we cannot make sure that that second dose can be given. So that's the background for that. That's the reason for that. We hope that people understand that. The Governor's Executive Order GA-29 is still in effect. That requires face coverings for people when they're out and about. There are some nuances to that, but the main takeaway is that we need to keep wearing our face coverings per the Governor's Executive Order and per the city's COVID-19 Pandemic Emergency Measures Ordinance. GA-32 is still in effect. The main takeaway from that is that businesses will remain at 50% capacity until we have 7 consecutive days under the 15% hospitalization rate as defined in the Governor's GA-32 Executive Order. Right now, there's lots of reasons for optimism. Vaccines are coming. We're having positive results in response to the COVID-19 Pandemic Emergency Measures Ordinance. But it's very important that we maintain our diligence as we can see the light at the end of the tunnel. We need to maintain diligence with face coverings and other measures designed to prevent the spread of coronavirus so that we can finish strong. Thank you for everything you're doing. I appreciate everything that everyone's doing. The emotions, the optimism that's going on right now. We need to carry out and finish strong with our face coverings and other measures. That's all I have, Dave.
Thank you, Jared. Let's now go to members of our media who are in attendance. If you have a question for an individual panel member or the panel as a whole, that's perfectly fine. Let's go ahead and start with Dalton Williams of KVI Channel 7. Dalton, how are you today?
I'm good. How are y'all today?
Thank you.
Good. So my first question is, are we preparing for a possible post-seasonal surge for those who have decided to still gather for Christmas and the New Year's season?
Oh yeah, this is Brian. I would say absolutely. We're ready. You know, we've kept our staff on alert, and and we thankfully at Thanksgiving we didn't see much of a bump, and I'm kind of hoping that maybe Christmas won't offer too much more of a challenge, but we are absolutely ready for it.
Okay, awesome. And then the next question I have is, the new strain of COVID that was found in the UK has just made its way to Colorado. So are these vaccines, are they equipped to handle this kind of strain of coronavirus, or is there anything that people should know about it?
From what we know about the new strain, these vaccines will work, and you know, viruses commonly mutate. You know, if you think about the flu virus, we have to update that every year. So it's not really unexpected that we wouldn't see a new strain like this. What does that mean for the future? It probably means that we need to be doing some surveillance, and I've already been in contact with the state to try to participate in surveillance, because Colorado is not very far from Amarillo. So we'd like to have some surveillance, have samples sent down there periodically and reviewed to see if the strain comes to our community. And then I think in the future, it's going to mean that we'll probably need to modify these vaccines, I would imagine, from time to time. But they still seem to be effective at present.
Doctor, can I ask a follow-up question on that? First of all, how much effectiveness does a person get from the first dose of a vaccine, either Moderna or Pfizer?
Yeah, it's probably hard to know, but probably somewhere between 40–50%, I would imagine. You know, the 2 doses statistically are about 95% effective for each of those. So you do get some benefit, but it's also important to get that second dose.
And I know this is a vaccine that has gone quickly through FDA approval. It's on an emergency use authorization. So we can't exactly answer this next question, but I'm going to ask it anyway. How long will that vaccine cover a person and protect them from a COVID-19 exposure?
You're exactly right. I don't think anyone really knows for sure the durability of this vaccine. You know, some vaccines that we have for other types of viruses like polio, et cetera, may be lifelong. But for this new virus, I think it remains to be seen. And I would expect it certainly to last through this wave, through this pandemic. And then as time goes on, as we do surveillance, we would probably be modifying that vaccine periodically.
Thank you, Dr. Dalton. Thanks for letting me interrupt and ask those questions.
No, you're perfectly fine. Thank you for asking those questions. And then my last question is the vaccine shipments. Nationally, we've kind of seen some slowdown. Are we concerned that we're not getting enough, or do we have the right amount of vaccines that we need for right now?
You know, I think the way these pandemics go, or this pandemic for sure, is that we've always been behind. So I would answer that. I would have loved to have had this vaccine 9 months ago. That being said, you know, we want to make sure as soon as we get vaccine that we're putting in people's arms. And that's going to be our job, is to get it in people's arms whenever we get it. It's just that we don't have much ability to know exactly how much we're going to be getting from week to week. And Casie can probably comment on that better than me.
Yeah, I think that I totally agree with Dr. Milton. I think that our community is well positioned. I think that we have received more vaccine than other communities, and not as much as some other communities. But I do think that we're well positioned to be vaccinating folks in our community.
Okay, awesome. Thank you so much. And that's all the questions I had today. Thank y'all for letting me be on this panel with you.
Thank you, Dalton. Let's now go to, if I'm not mistaken, I think we have Aaron Langston of KAMR Channel 4, or at least a representative from KAMR Channel 4. How are you today?
Dave, while we're waiting for them to get on, can I ask Casie and Dr. Milton a question about residents who live in Canyon? Will there be any Canyon locations? Now, I know our public health district covers Potter and Randall counties, which includes Amarillo and Canyon. And I've been doing a lot of talking about Amarillo, but I'm wondering, obviously Canyon citizens can come to the Civic Center and get a vaccination. That's a given. Do you know anything about whether or not there will be a Canyon location for vaccinations?
Yes, so if you look at the allocation, the allocations per week, there have been vaccine already distributed in Canyon. There's a pharmacy that received vaccine there in Canyon. And then the providers in Canyon, I'll look to see which providers in Canyon have signed up. And so there is an ability for vaccine to be distributed in Canyon, yes.
Thank you.
Let's try it one more time with KAMR Channel 4 today. I think this is maybe Aaron Langston or another reporter from KAMR Channel 4. At this time, we will move on. I think we have Vanya Patino from KFTA Channel 10. How are you this morning?
Everyone, I'm good. Thank you so much for allowing me to speak on this, to ask questions on this panel.
Sure.
So the first question is, where are these vaccines that are being administered at the Civic Center being stored? Casie, I don't know if you can answer that.
So the vaccines are stored in the refrigerators and freezers at the Public Health Department. And then we are administering those at the Civic Center.
Was that something that y'all had to buy, or you all kind of already have that equipment available?
So this is equipment that we had available to us.
Okay, got it. Thank you. And do you know how many people have been vaccinated so far through the Civic Center?
I know that we gave Monday just under 500, I think Tuesday a little over 500, and I don't know how many we have seen today, but it's been a busy morning.
Got it. And you kind of mentioned there was sometimes a waiting time. Is there an average that people should know about how long maybe they should be waiting?
Just talking to people as they were in line, people said, they're waiting maybe about 40 minutes or so. So that's not a terribly long time, but there is a little bit of a wait. So we just want people to know that when they do come.
Got it. Thank you.
Casie, I just got a text from a resident who just went through the through the vaccination site. They said it was 45 minutes from door to door, from their car door back to their car door. And they couldn't be more impressed with the efficiency of the operation. So kudos to Casie and her team.
Awesome.
Yeah, our team is working so hard, and we're pleased to be caring for people and providing vaccine. And we're glad that the wait's not too long. There is always a little bit of a wait, but we're really, our team is working so hard. They're amazing.
Well, that 45 minutes included screening at the door, paperwork, a couple of stations where you answer questions, the vaccination, and then the 15-minute hold period prior to leaving. So there's a lot of things that are happening there. So it's moving fast.
That's great. And then Casie, also for those who are administering the vaccine, is it all public health department nurses, or are y'all getting help maybe from other nurses?
So we're using the public health department staff. We do have some temporary staffing that have joined our team, but these are team members that have been on our team for some time. And then we also have the fire department, some members from the Amarillo Fire Department that have joined our team for this event.
Got it. And do you know how many people are administering?
I think we have 18 booths running where there's vaccine being given.
Great. And then you also mentioned, you guys had been checking the website religiously to see when you would get it. Was there anything in plan, or were y'all prepared to receive them when they did arrive?
Yeah, so our staff we do have staff at the health department, and they're ready to receive shipments whenever they come.
Great. And then lastly, I know that Jared Miller had said that some people didn't want to share some information. Do you know what is the information that people should be prepared to give when they do arrive?
Right, so just basic demographic information is really all that is, and then we include that information into the M-Track system, and that is a system that if your record is lost or destroyed, then we can pull your shot record up and provide that information to you if you need it in the future. It's also how the state is tracking the doses so that they know when to ship us the second dose so that we can provide you that second dose. And so just basic, demographic information, name, phone number, address. So information that people would have, and it's easy for people to remember.
Got it. Okay, that was all my questions. Thank you so much for your time and information. I appreciate it.
That concludes our news conference for today. Again, this is David Henry. I'm the Communications Manager for the City of Amarillo. All of our panel members who took the time out to participate today and provide this information to the community. Once again, we do these once a week, every Wednesday at 11 a.m. Thank you, everyone.